Hello, learners. Welcome to Lecture 17, the fifth in our third module. We will deal with adolescent health programs addressing reproductive health education in this chapter. So far, we have explored maternal health, child health, and family planning programs. Today, our focus shifts to adolescents, a group often overlooked but critical to public health. Adolescent health programs are vital because this stage is a bridge between childhood and adulthood, where habits, values, and health behaviors are shaped. We will examine major programs, reproductive health, education, and challenge unique to this group. By the end of this session, you should be able to define adolescent health, appreciate its public health significance, and recognize the issues unique to this age group. You will become familiar with programs such as RKSK and ARSH. We will also explore reproductive health education, its methodologies, and cultural challenges. Finally, we will reflect on persisting gaps and strategies to strengthen adolescent health services. Adolescence, defined by WHO as 10 to 19 years of age, is a critical age of growth marked by rapid changes in body, mind, and social roles. This phase determines future health and well being. With 253 million adolescents, India has the world's largest population of adolescents, making their health a demographic priority. Their needs must be understood in the context of their unique vulnerabilities and opportunities. Adolescent health is important because early pregnancy poses health and social risks. Many adolescents, especially girls, suffer from anemia and malnutrition. Increasingly, mental health issues such as stress, depression, and substance abuse are being reported. As adolescents transition into adulthood, their health determines the health of the future generations. Addressing adolescent health directly contributes to SDG targets on health and education and gender equality. Adolescent friendly health services should offer confidential counseling, non judgmental care, and easy access to contraception and treatment of sexually transmitted infections, including post sexual assault support. Nutrition interventions. Weekly iron folic acid, deworming where indicated, dietary diversification, and screening for underweight or obesity tackle anemia and growth problems. Menstrual health education and supplies reduce school absenteeism. Menstrual health education and supplies reduce school absenteeism and stigma while improving hygiene and dignity. Comprehensive sexuality education builds skills for consent, safer relationships, and delaying first pregnancy, while engaging boys addresses gender norms and violence. Mental health care must be integrated into schools and clinics. Early screening, brief counseling, crisis referral, and peer support programs. Substance use prevention should combine life skills curricula, family engagements, and regulation to access of tobacco, alcohol, and emerging products. Digital risks, online harassment, misinformation, and addictive use require media literacy training and safe use protocols. Finally, multi sector platforms create supportive environments that advance SDG 3, 4, and 5 through healthier, empowered adolescents. Adolescents face a range of health challenges. Nutrition deficits, particularly anemia, are widespread. Reproductive health issues, including early pregnancies and unsafe abortions, are critical. Mental health concerns driven by academic stress and social pressures are rising. Substance abuse, violence, and injuries further complicate their well being. These multifaceted issues require comprehensive multi sectoral solutions. Adolescent health services must adopt a comprehensive framework. Preventive and promotive services include nutrition and life skills education. Curative services cover illnesses and injuries, while counseling provides psychosocial support. These services should be accessible at schools, communities, and health facilities, ensuring coverage for both in school and out of school adolescents. The URSH strategy, launched in 2005, was India's first structured approach to adolescent health. It focused on providing reproductive and sexual health services through adolescent friendly clinics. The strategy emphasized privacy, confidentiality, and non judgmental services, aiming to overcome barriers faced by adolescents in accessing care. This laid the foundation for later broader adolescent health programs. The ARSH strategy, Adolescent Reproductive and Sexual Health Strategy, operationalized adolescent friendly services by creating dedicated adolescent friendly health clinics at primary health centers, community health centers, and district hospitals with trained counselors and flexible teen friendly hours. It paired clinics with outreach, school and community sessions, peer educators, and social and behavior change communication to reduce stigma and improve health seeking. Service packages covered contraception and counseling, management of RTI STIs, menstrual health, nutrition, and anemia control, and care after sexual assault with strong referral linkages. Privacy and confidentiality were built in through separate spaces, signages assured one to one counseling, and no judgment protocols for both boys and girls. Capacity building focused on doctors, ANMs, ASHAs, and counselors to standardize quality and adolescent appropriate communication. Simple registers and monthly reviews tracked football, commodities, and referrals to drive local improvement. Crucially, Arsh created the platform that later expanded into the broader Rashtriya Kishore Swasthya Karikram, with additional thematic areas like mental health, substance abuse, and non communicable disease risk. Rashtriya Kishore Swasthya Karikram broadened adolescent health programming beyond reproductive health to include nutrition, mental health, non communicable diseases, violence, and substance abuse. It incorporates life skills education, empowering adolescents, and decision making and coping skills. RKSK uses peer educators and community platforms, making it participatory and youth centered. It reflects a holistic, rights based approach to adolescent health. RKSK operationalizes a six thematic package: nutrition, sexual and reproductive health, mental health, injuries, violence, substance misuse, and non communicable disease risk reduction, delivered through the schools and communities. Satya, peer educators, led small group sessions use life skills modules on consent, communication, problem solving, and help seeking with clear referral pathways to adolescent friendly health clinics. Platforms such as Adolescent Health and Wellness Days, School Health and Wellness Program, and weekly iron and folic acid supplementation create regular touchpoints for screenings, counseling, and follow up. Menstrual hygiene program ensures pads, education, and disposal solutions to reduce absenteeism and stigma. The program emphasizes inclusion, reaching out of school youth, boys, adolescents with disabilities, and those in hard to reach or marginalized communities. Convergence with education, women and child development, and police legal aid strengthens response to violence, trafficking, and cyber harassment. Monitoring uses simple indicators and feedback from adolescents to improve quality and confidentiality. Increasingly, RKSK integrates digital helplines and vetted content to counter misinformation and extend confidential support. Peer educators are unique feature of RKSK. Adolescents are trained to act as peer leaders, providing health information and support within their communities. They deliver sessions on nutrition, sexual and reproductive health, and life skills. As peers, they gain greater trust and acceptance compared to adult providers, making services more accessible and adolescent friendly. Adolescent friendly health clinics were set under ARSH and strengthened under RKSK. Located at primary health centers, community health centers, and district hospitals, they provide counseling, contraceptives, and treatment for reproductive tract infections and sexually transmitted infections. Adolescent friendly health clinics emphasize privacy and confidentiality, critical for adolescent acceptance. They also establish linkages and schools with schools and communities to widen their outreach. The school health and wellness program integrates health into education system. Teachers act as health and wellness ambassadors, conducting sessions on nutrition, mental health, reproductive health, and life skills. The school based approach ensures large scale coverage and strengthens adolescent health literacy. Linking health and education creates supportive ecosystem for adolescents. The program trains two school health and wellness ambassadors per school to deliver structured, age appropriate sessions during the school timetable with simple flipbooks and activities. Core packages include nutrition, midday meal, weekly iron, folic acid, and deworming, menstrual health and hygiene, mental health literacy, and first aid life skills, reproductive and sexual health, and prevention of substance abuse and violence or bullying. Teachers identify students needing extra help and create referral linkages to adolescent friendly health clinics, RBSK screening teams, counselors, and emergency services. Schools strengthen wash, safe drinking water, clean gender segregation toilets, disposal for menstrual waste, and promote washing clubs and hygiene drives. Parent teacher meetings and peer led activities normalize conversations on puberty, consent, digital safety, and help seeking, reducing stigma and misinformation. Convergence with education, health, and women and child development ensures supplies, counseling materials, and protections against harassment and exploitations. By embedding health in everyday schooling and program improves health literacy, early detection, and equitable access, especially for girls and marginalized adolescents. Reproductive health education equips adolescents with essential knowledge about puberty, contraception, STIs, and consent. It empowers them to make informed choices, reducing the risk of unintended pregnancies and infections. By addressing myths and stigma, reproductive health education promotes healthy, responsible behaviors. It is a cornerstone of adolescent health services. Life skills education complements reproductive health education. It focuses on decision making, problem solving, and communication skills. Adolescents learn to resist peer pressure, negotiate relationships, and cope with stress. Life skills promote self confidence and resilience, preparing adolescents for challenges in both personal and social domains. Adolescent nutrition is prioritized through programs like WIFS, which provides weekly iron folic acid tablets. The midday meal scheme continues to support school going adolescents. Poshan Abhiyan ensures intersectoral convergence of nutrition. Reducing anemia, especially among adolescent girls, is a key objective, breaking the cycle of malnutrition across generations. Anemia Mukt Bharat adopts a life cycle approach, especially targeting adolescents. It promotes weekly iron folic supplementation, biannual deworming, and nutrition education. Adolescents are engaged in hygiene promotion and healthy diets. The integrated approach ensures adolescents enter adulthood healthier, addressing one of the India's most persistent health challenges. Anemia Mukt Bharat follows a 6 into 6 into 6 strategy, that is 6 target groups across the life cycle, 6 key interventions, and 6 institutional mechanisms to drive rapid anemia reduction. For adolescents, it operationalizes weekly iron folic acid supplementation and biannual deworming through schools, colleges, and community platforms with peer support and counseling to improve adherence. Programs pair tablets with diet education, promoting iron and folate rich foods, vitamin C enhancers, and reducing tea coffee with meals to tackle both intake and absorption barriers. Point of care hemoglobin screening with digital hemoglobinometers enables early detection, on the spot counseling, and referral of moderate to severe cases. Wash actions: safe water, sanitation, menstrual hygiene management, and malaria or soil transmitted helminth control address infections and environmental contributions to anemia. Convergence with RKSK and the School Health and Wellness Program ensures regular touchpoints with Poshan Abhiyan links households to social safety nets. Supply chain strengthening and simple monitoring dashboards track coverage, stockouts, and hemoglobin improvement. By reducing adolescent anemia, Anemia Mukt Bharat improves school performance, physical capacity, and future maternal outcomes, helping India meet SDG targets on health, learning, and gender equity. Mental health issues among adolescents are on the rise. Stress, depression, anxiety, and even self harm are increasingly reported. Academic pressure, peer competition, and social media exacerbate these challenges. School based counseling services can provide early support, but stigma often prevents adolescents from seeking help. Addressing adolescent mental health requires destigmatization and stronger school community health linkages. Adolescents are vulnerable to substance abuse, including tobacco, alcohol, and drugs. Peer pressure and curiosity often initiates experimentation. Substance abuse can have severe health and social consequences, including addiction, academic decline, and violence. Prevention efforts through education, awareness, and counseling are crucial to protect adolescent health. Gender significantly shapes adolescent health outcomes. Early marriage and childbearing put adolescent girls at risk of poor health and morality. Gender significantly shapes adolescent health outcomes. Early marriage and childbearing put adolescent girls to risk of poor health and mortality. Gender based violence and restricted mobility further marginalizes them. Social norms often prevent girls from accessing health services. Promoting gender equality is therefore central to adolescent health programming. Adolescents are not just beneficiaries but stakeholders in health programs. Involving them as peer educators, youth club members, and decision makers enhances program ownership and relevance. Participation fosters leadership and advocacy skills. Programs that meaningfully engage adolescents are more likely to success and sustain impact. Meaningful adolescent engagement starts with co design. Invite girls and boys to help set priorities, craft messages, and test services so interventions reflect real needs. Create structured roles: Satya, peer educator; school health leaders, youth club convener, with clear training, supervision, and small incentives to sustain participation. Establish safe, inclusive spaces and safeguarding protocols so marginalized adolescents can participate without stigma or harm. Use your scorecards, suggestion boxes, and WhatsApps or SMS polls to capture feedback and track whether changes are made. Involve adolescents in social accountability, community meetings, so their evidence influences their evidence influences budgeting and service quality. Build leadership through life skills, advocacy workshops, and opportunities to speak to local officials or media. Recognizing their contributions through certificates, internship credits, and linkage to livelihood skill programs to strengthen futures. Monitor engagement and simple indicators and share results back to adolescents to reinforce ownership and impact. These are the few suggestions which can be done to improve the health and healthful living of the adolescents. Families and communities strongly influence adolescent health behaviors. Parents are primary influencers, shaping attitudes towards reproductive health. Community support helps overcome stigma and taboos. Local governance bodies can facilitate awareness campaigns and youth programs. Building family and community partnerships strengthens the ecosystem supporting adolescent health. Challenges to adolescent health programs include persistent stigma around reproductive health education. Many health services are not adolescent friendly, discouraging use. Awareness and IEC efforts remain limited in rural and marginalized communities. There is also a shortage of trained counselors equipped to address adolescent issues sensitively. Overcoming these barriers is critical. Monitoring and evaluation are essential to track the effectiveness of adolescent programs. Indicators include service coverage, utilization, and behavior change. Data systems like HIMS, NFHS, and GATS provide insights. Feedback loops ensure continuous improvement. Including adolescents in evaluation process ensures that perspectives shape future strategies. Globally, adolescent health is priority under WHO's global strategy, which links it with women's children's health. The SDGs explicitly target adolescent needs under health, education, and gender equality. UNFPA and UNICEF lead global adolescent initiatives. International partnerships provide funding, technical support, and advocacy, aligning global and national adolescent health efforts. India has made notable progress in adolescent health. Programs like WIFS have reached millions. AFHCs are operational across the country. The peer educator model has been scaled up, enhancing community engagement. Strong policy frameworks like RKSK signal sustained commitment. These achievements provide a solid foundation for further progress. Despite achievements, gaps remain. Adolescent fertility is still high in certain states. Anemia and malnutrition rates continue to affect both boys and girls. Mental health services for adolescents are scarce. Programs often focus disproportionately on girls, overlooking boys' health needs. Addressing these gaps require comprehensive and inclusive planning. Innovations in adolescent health increasingly use technology. Mobile apps provide health information and reminders. Online counseling platforms offer confidential support. Digital life skills training equips adolescents with coping strategies. Social media campaigns spread awareness, especially among urban youth. These innovations bridge gaps and resonate with digital native adolescents. Teachers and schools are crucial to adolescent health. As health and wellness ambassadors, teachers provide education on health and life skills. They can identify early signs of mental stress, substance use, or health problems. Schools provide a safe environment for discussion. Collaborating with health workers ensures a comprehensive support system for students. The way forward requires strengthening adolescent friendly services, ensuring confidentiality and accessibility. Reproductive health education must be expanded and destigmatized. Mental health must be integrated as a core component. Promoting gender equality and engaging adolescents as active participants will make programs more effective and sustainable. Key takeaways from today are adolescence is a critical life stage influencing lifelong health. Issues such as nutrition, reproductive health, and mental health intersect. India's RKSK and related programs have broadened the scope of adolescent health services. Reproductive health education is central to the empowerment. Yet, challenges persist, necessitating innovation, equity, and community engagement. This concludes Lecture 17 on adolescent health programs and reproductive health education. Alongside family planning, maternal, and child health lectures, we now see how adolescent completes the life cycle approach. I encourage you to think how adolescent health links to broader determinants like gender, education, and technology. In the next lecture, we discuss about the community health workers. Thank you.